Audio Jungle. Audio Jungle.
Musculoskeletal ultrasound is used in for last 2 to 3 decades extensively by the MSK radiologists, and not only radiologists but by the other experts like anesthesiologists, physiotherapists and the sports medicine people. One of the biggest development in ultrasound as far as the 2D imaging is concerned is the improvement in the transducer technology. Now, with the availability of the high frequency transducers in the range of 8 to 18 megahertz or up to 20 megahertz, what has happened that the resolution of the ultrasound has become far superior to MRI. Even with the today 3 Tesla MRI and dedicated coils and different softwares, the MR resolution cannot match with that of the currently available ultrasound transducers, and this has made significant difference in the MSK imaging, and I have been using for last almost 2.5 decades for its application, and I have found there is significant improvement has taken in the quality of the 2D imaging, and that has made significant difference in the diagnosis of various musculoskeletal pathologies.
I guess by 2D you mean ultrasound.
Yes.
In MSK evaluations.
Yes.
And over a period of time, I do realize that it will take a little while for the consultants, for the radiologists and for the referring physicians to understand the value of the ultrasound imaging in MSK. But if it's my personal choice, I would always want, if a patient comes into my clinic, more often referred, I would definitely want to put in a probe to see where exactly I stand. So I don't think that it's a very right thing to compare two modalities like CT, MRI and ultrasound, because each one has its own place and value. They are really complementary. There are things that we see so beautifully in an MRI, and there are things on dynamic static imaging. So dynamic imaging of ultrasound probably has helped it to evolve and come to a better level of acceptance amongst the radiologists as well as the consultants.
So I think one of the key developments that is taking place in the MSK ultrasound imaging is the development of the elastography, development of the contrast enhanced musculoskeletal ultrasound, and these are the two future technologies which are going to make a difference in the MSK imaging. So using the elastography, we can sometimes pick up the changes in the tendon much earlier before it becomes evident on the 2D imaging. Similarly, if you use a contrast enhanced ultrasound studies, you can pick up neovascularity which is associated with the inflammatory conditions or with the degenerative disease with the tendinosis. This can be picked up much earlier, even then it becomes evident on the power Doppler or color Doppler imaging. And of course, the development of the panoramic view helps a lot in the demonstrating the pathology in relation to the adjacent soft tissue structure. That can be appreciated better by the clinicians, so they can correlate their clinical findings with the ultrasound findings using in the panoramic view.
Right. I am looking forward to working on a 3D imaging, and I'm sure that GE is also working on it and are bringing in something in 3D and MSK imaging, which will enormously help us to have the correct orientation, which is really important when we are talking of something as anatomical with bones and joints. So we do need that 3D perspective, which CT has got the advantage of. The other thing, of course, I'm keenly looking forward to good classic elastography, not a strain, but if shortwave or if the shear wave elastography can be also incorporated, that should be immensely nice thing to do. Apart from that, yes, a better higher frequency probes, lighter probes, probes that can be handled with lesser of the pressure going, because these are very superficial structures. So the heavier the probe, the more difficult we have to actually evaluate, particularly hands and feet. And of course, if GE is working on a fusion technology with MRI, that should be great.